Hello everybody, this is Dr. Shafiq Safi again, also known as the EndoDoc on YouTube, live from Centre Endodontique Saint-Laurent in Montreal, Canada. Today I want to discuss with you a case that shows the advantages of having or of using a CBCT and a dental operating microscope in endodontics in order to really treatment plan, diagnose, and really be able to help the patient with whatever he or she is experiencing. So last week I got this gentleman into my clinic who came and he told me, "Doctor, I have this pain in my upper jaw. It's hurting me, it's aching me. I don't know where it's coming from." He was pointing on his left hand side, but he didn't know really if it's the back tooth or the one before the last tooth. So I sat him down and I took down all his notes and I wrote down all the medical history and all the dental history. And I did my exam. It wasn't very conclusive. I was not able really to identify one tooth that stands out in terms of reproducing the pain of the patient. The patient has, well-maintained dentition in general. He got some crowns and some work done over his life. And I took an x-ray, as we can see here, of the two last upper left molars. And as we can see, these two teeth have two big crowns on there, and he was always pinpointing to that side but not knowing which tooth was really the problem. And I was not able really to diagnose or to really exclude one tooth or the other. So I suggested to the patient to take a CBCT, which is, as you might have seen in one of my previous videos, a imaging technique that lets us take three-dimensional images of the tooth so that we can inspect it in any angulation and really be able to see what is happening at the level of each tooth separately than the other teeth. So on this x-ray here, everything is really superimposed. Everything is really stuck together. You have the two teeth next to each other. You have a big sinus here. You have the bone. So there's a lot of things on top of each other. And unless you are Superman, you cannot really see through this x-ray correctly. So when we took the CBCT, it gives us a completely different dimension of the patient's problem. On the CBCT, I was able to directly diagnose the tooth that was really problematic or painful, which is the last molar, as we can see here. We can see on the two arrows here pointing at two big, what I call Mickey Mouse ears, or these two big black bubbles around the tooth, which signifies that this is the tooth that is infected. This is why the patient is in pain. And there was no other lesions or no other black bubbles or circles around any other teeth in the area. And so I was really able to say that this is a tooth that was problematic. Now I inspected the tooth on CBCT to see if there's something else in there that could explain the development of these lesions, other than, of course, the logical reason, which is having a crown on the tooth. I was wondering if maybe the tooth is cracked, but I wasn't able to see that on the CBCT. But I had warned the patient that the tooth might be cracked, seeing that there's some bone loss on the distal here. That can sometimes signify that the tooth is cracked, and the tooth has a very old crown that has been worn down, so the tooth has served a lot. So the patient agreed to do a root canal treatment on the tooth, since this is the tooth that is problematic. And while I was doing the root canal treatment, after accessing the tooth and inspecting it using a dental operating microscope, which is this guy right here, which is going to identify himself by lighting a couple of times various colors of the rainbows. This microscope helps us in really seeing our field of view much bigger than the naked eye, or much bigger than just regular dental loops. It helps us really see the minute details inside the tooth. For example, to be able to see any missed canals, any calcifications, any posts, any broken instruments. We could take pictures, as I'm going to show you. We could take videos to be able to educate the patient, send whatever we find to the referring dentist, so that we have a clear proof of what the problem is. All the treatments in Centre Endodontique Saint-Laurent are done under the dental operating microscope without any exception. Whether it's a root canal treatment, whether it's a retreatment, whether it's an endodontic microsurgery, and even sometimes for diagnosis to inspect the crown of the tooth or to inspect to see if there's any caries underneath a bridge or underneath the gum, or if there's any problem that we cannot see with our naked eye. So back to our case here, as I was cleaning the tooth and I looked inside the dental operating microscope, I was able to see that there was a crack inside the tooth that I could not see with the CBCT. And as we can see here, we can see that there's a line that goes from the distal marginal ridge and all the way down into the palatal orifice, which really explains why the patient is in pain. So the tooth got cracked. The crack is a point of entry for bacteria, for saliva. The tooth got infected and the patient is in pain. Unfortunately, when we see these kinds of observations inside the tooth, it becomes very hard and sometimes even impossible to save the tooth, which is why in this case, I stopped the treatment, I temporized the tooth, I showed this picture to the patient, and it was self-explanatory. The patient really looked and said, "Oh my God, my tooth is cracked." And I told him, "You're right, sir. This is the picture from inside your tooth. Your tooth is cracked, and thus we need to refer you for it to be extracted." Had we not used a dental operating microscope, we could not have detected this crack. Had we not used the CBCT, maybe we would have treated the other tooth rather than the right tooth. So all these tools and technology are important to be able to help us diagnose and treatment plan and help the patient, and ultimately fulfill our duties as a dentist, as an endodontist, or as an oral healthcare professional, which is to help the patient and put their well-being in front of any other interest that some of us might have. Thank you for watching the EndoDoc again. This is Shafiq Safi live from Centre Endodontique Saint-Laurent in Montreal, Canada.